Hello, everyone. Happy Thursday to you. Hopefully, most of you have the day off tomorrow, and then we'll celebrate Christmas with your families or your holidays off with your families over the next couple of days. I'm Rendy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to give you an update this week of the impact of the COVID-19 pandemic on Mobile County. So earlier this week, Mobile County passed a threshold of 75,000 cases of COVID-19 recorded since the outbreak began here in March of 2020. So today, on our daily report, we're reporting on 75,308 cases of COVID-19. That in itself is alarming. I think the more alarming thing is that yesterday, 101 new cases of COVID-19 were reported to us. The past 3 days, we've had 105, 98, and 99 cases reported to us, and this is a doubling in the number of cases that were reported to us on average just 7 days ago. So very quickly, we have seen a doubling of the number of cases reported in Mobile County residents, and I don't expect it's going to change. I don't think this is a fluke. It's not due to lab errors. It's likely due to the presence of Omicron in our county and the very fast increase in the transmission, because that variant is so much more highly transmissible than Delta. So I'll talk a little bit more about variants in a few minutes. So we reported no additional deaths yesterday. That's really good news. We sit at 1,396 deaths. And yesterday, 6 new hospitalizations, or 6 people in the hospital, were newly diagnosed with COVID-19. I think the thing that's also concerning to us is that yesterday there were 28 people in the hospitals, in mobile hospitals, with COVID-19 diagnosis. We've seen this number. It seems like a rather low number. The part that concerns us is that it is slowly creeping up. So, in early November, when we were hitting our very low numbers for hospitalizations, I think it got down around 12 to 13%. Then it started going up to around 20s, went to the mid-20s for about a week, and now we're approaching 30 people in the hospital with COVID-19. So this is certainly something that we are concerned about and that we're continuing to keep our eye on. So we likely will be starting back, just particularly this week and next week, at least have Facebook Live one day a week, probably on Thursday, so that we can give you another update right before the New Year's holiday. I just want to give you some other pieces of information that have come out since we talked last. The Alabama Department of Public Health issued a health alert advising or reminding or informing providers that the COVID-19 Omicron variant may negatively affect test results of currently used COVID-19 tests. So tests that are not effective in detecting Omicron, we're finding more and more about these every day. There is a website. We'll make sure to put this website on our Facebook page. If you're using any of these tests, it means that if you have a patient who's infected with Omicron, they may test false negative on these test platforms. So it's really important, if you provide COVID testing and you're using some of these testing platforms, that you check the website, see if yours is on the list, and adjust accordingly. Also, I think since we talked last, maybe we talked about this last week, the Advisory Committee on Immunization Practices recommended the use of Moderna or Pfizer vaccines over Johnson & Johnson's for people who have never been vaccinated, unless there is some reason that a one and done Johnson & Johnson vaccine is better suited for you. Certainly any vaccine is better than none, but they were recommending Pfizer and Moderna over Johnson & Johnson due to abundance of supply of Pfizer and Moderna, and then the small risk of blood clots in some people following J&J vaccination. So if you were vaccinated with J&J and you want to get a booster, you can do that. Seek a Moderna or a Pfizer booster up to 2 months after your J&J immunization. Also wanted to to remind everyone that we, encourage everyone, and, particularly if you're a healthcare provider and you're seeing patients who may be coming in for illness, we just want everyone to remember to know before you go. So if you are traveling for the holidays, if you're sick, please stay home and don't travel. But if you have time, we want you to go and get tested before you travel, so that you will know, knowledge is power. You will have good information for whether or not you should go ahead and get on that flight or on that bus or train or in the car with the extended family going to grandma's house. So there are at-home tests, or what we call self-tests. So you can do a self-test. Those are available at most pharmacies in the area right now. I picked up a couple at my area, my local pharmacy, just last night. This is when CDC is recommending you consider self-testing. So use a self-test before joining indoor gatherings with others who are not in your household, or if you live with someone who's at higher risk for COVID-19 disease. Self-testing is one of many risk reduction strategies. So you can get vaccinated, wear a mask, physical distance, wash your hands, protect yourself and others by getting tested before you're out and about, and particularly if you're going to travel, to prevent spreading the virus. And the self-test also can be used whether you've been vaccinated or regardless of whether you have symptoms. Any test can be used whether you're vaccinated or have symptoms of COVID. So really, we just want you to remember, know before you go. Before you go, if someone invites you over for a holiday party and you're not sure if people there have been vaccinated, or maybe you're going to some party or dinner where there are going to be, people who are older there, or people who might, have conditions that might make them more severely, if they get COVID, even if you're vaccinated or if you're asymptomatic, it's, always good information to have. If you take a test, get tested before you go. So again, many pharmacy locations have over-the-counter tests. They're quite pricey. I had a little bit of sticker shock when I had to pay $50 a box, and that was for just 2 tests, but that was for at home, the convenience that comes with being able to do it at home. But if you can't find any, you can always come to our walk-in clinic at 101A Festival Center, where we provide free walk-in rapid testing results while you wait 6 days a week. So remember to go to mchdcares.com. We do have some altered hours because of the holidays. So if you do test at home and you're positive, you need to stay home for at least 10 days, making sure that you're feeling better at least 24 hours before lifting isolation if you do have symptoms, or at least 10 days after your positive test result. And if you've been exposed, you may want to self-test, 3 to 5 days following that exposure. But then even if you test negative, if you think you've been exposed, stay at home, wear your mask when you're around others, and then test again at, 12 to 14 days, because we want to make sure we still have that 2 to 14-day incubation period. Some other information, I think this just came out today from the State Health Department. The first antiviral pill to treat COVID-19 has been authorized, and a limited supply is expected in Alabama within 2 weeks. So this is an oral antiviral drug called Paxlovid, which treats COVID-19. Early data indicate that 88% effective in reducing the proportion of people with COVID-related hospitalizations or deaths. So that is really great news. It's tablet form, and the initial limited supply of 780 patient courses will be available by prescription only the first week of January in Alabama. So again, 780. So it's great that we're getting an allocation of this new antiviral, but it's a reminder that these things are in limited supply. Monoclonal antibodies for treatment are in limited supply. Other treatments are in limited supply or may have limited effectiveness against Omicron. So please, your best course is to prevent infection, severe illness, and deaths by getting vaccinated. We still have really, really good vaccines, safe and effective, and we have plenty of them. So now anyone 5 and older can get vaccinated to protect themselves from infection, hospitalizations, and deaths. But there are new treatments coming available. So with that, I'm going to take a pause. I have a big long list of questions from the media, but Dr. Eishold, our health officer, is here and wants to share a couple of things with you here on Facebook Live today. Dr. Eishold.
Thank you very much, Dr. Murphy. It's an interesting time we have with COVID. The variant is present in Alabama. The variant is more contagious than the previous Delta form of the virus. We're working very hard on vaccinating and providing testing for persons. So really the important thing that I really want to stress to everyone here is one, the holiday seasons are upon us. If you're going to church, please wear a mask regardless of your vaccine status, because you do not want to, one, give somebody else sick, and you don't want someone else to get you sick. Even if it doesn't require you to go to the hospital, let's use a little caution right now as we go into the holiday season, especially going to church. It may be for our ministerial community that maybe designate an area in your church for fully vaccinated persons, so your parishioners who can come to church during this important time of year will feel a little more safe and secure. Again, let's all try to wear a mask while in church. And know that this is a virus that we're going to be able to deal with. We have hospital capacity at this point in time to take care of patients. But the most important thing we can do is not get sick. The most important, best way to not get sick is please get vaccinated, even if you've recovered from COVID, from a different variant than we have now. But go ahead and get vaccinated. If you've already had a vaccination, please take a booster shot to give you the full best immunity that you can have. And right now, the data shows that we're on an uptick of patients being admitted to the hospital. So since November, we have a 59% increase in the number of patients that we've had in the hospital previously. The numbers are relatively low. But in the past 2 days, one day we had 11% increase in patients admitted to the hospital from COVID, and then yesterday a 7% increase. So just think of those numbers and take them out, what that would look like over a 3-month period of time, or even a 30-day period of time. So we need to just be cautious. We've done this before. We can do it again. I have the greatest faith in everybody who lives in Mobile County, Alabama, to try to be the best they can be. And the faith is that they will comply for a short period of time, masking, distancing, washing your hands, and finally getting vaccinated for those who've had any hesitancy. The vaccine is fully FDA approved. So for those who are worried about being experimental or unknown, I've been vaccinated. My wife's been vaccinated. I've taken the booster, and I encourage everybody to do the same. Thank you very much. Have a very Merry Christmas, Happy Holidays, and a Happy New Year. And may all your holiday seasons be blessed with health, happiness, and 2022 will be a great success. Thank you.
Thank you, Dr. Eishold. You know, at the health department, 85% or greater of our employees are fully vaccinated, and we're very proud of that fact, and we really encourage, I think at the health department we have, less than 60 people who have not received at least one dose of COVID vaccine, and most of us have received our full vaccine schedule and have also been boosted to try to make sure that our work family stays well and that we're able to continue doing the great work of the health department and providing clinical services to the family health patients and providing public health services to everyone in Mobile County. So let me address a couple of questions. I think I've got it here. Yes. All right. Okay, deep breath. There's a long list of questions today, so I will do my best to address them all. even though it might take a little bit of time. So I will not be offended if you turn away from Facebook Live to do the other good work that you need to do on the Thursday before a holiday weekend. So a question, can I speak to the flu? That news is saying that the influenza vaccine is less effective against the dominant strains this year, and is there a concern of a twindemic? So the percent match of the flu vaccine is something, the data on that develops over time during flu season. It's still pretty early in our flu season, so we're early in our data collection and evaluation is still underway. But even if the current influenza vaccination does not provide a great protection from flu infection, or if it's what they call a mismatch, still getting vaccinated for flu will reduce severity of disease should you become infected for flu. So it's still really important to get vaccinated, even if it turns out to be not a great match with the strains of influenza that is circulating this year. Should people still get the flu vaccine? Yes, we will continue to recommend that anyone 6 months or older should get a flu vaccine. It's not too late. We'll keep saying this probably on into March and April. And then asking about how flu hospitalizations are tracked, or if flu hospitalizations are tracked. So by state law, the only influenza that is required to be reported to the public health department are influenza-associated deaths. So influenza-associated deaths are reportable by law to the health department, and we investigate those. We also track through hospitals and provider offices the percent of all provider visits that are attributable to influenza-like illness. So, for example, all of our Mobile hospitals provide emergency department data on emergency department visits every day, and there are other providers around the state that provide information on, if they have 100 visits that day, how many of those were for influenza-like illness. So if 5 out of the 100 was for ILI, then we've got a 5%, 5% of all visits are attributable to ILI. So that's the statewide network that's been in place for a really long time. So for right now, statewide, 3.25% of visits are for ILI, and that is very close to the threshold of concern. I think the threshold for concern this year is 3.29. So statewide, the average, we're almost there. In Mobile County, we're currently at 2.79. So right now, of the providers that participate, including all the Mobile hospitals, 2.8% of visits are for influenza-like illness. And just to give you an idea, we can probably put this link into Facebook, Mark, but ADPH publishes a report each week during flu season that shows how we're trending this year compared to the last couple of years. So I'll remember to give that to you, Mark. Make sure that you get that. All right. So on to, I think the rest of these questions have to do with COVID. So let's get to those. Someone asking or noticing that the 7-day average in positivity of tests has gone from 7.4% on Monday to 12% today. And that's statewide, seems remarkable jump. And yes, so we have observed a doubling of cases in the span of a week and nearly doubling in the percent positive in the span of 1 week. So this is incredibly concerning and typical for what other jurisdictions are seeing with the introduction and spread of Omicron variant. So the next question was, is it attributable to the Omicron variant, and if it's been identified in Mobile County? So statewide, the official count of Omicron in Alabama is at 4. 1 in West Central, which we learned about last week, and then 3 in the Northern District. This is the official count. So those 4 were out of 92 total variants of concern that were reported to Alabama in the last 14 days. So this puts it at 4% for the state right now. the important thing to remember about this is that, remember, the first case from West Central, that patient had mild illness but had not traveled outside of Alabama, implying or confirming that that person became infected with Omicron through local transmission. So those are the official numbers. Earlier today, I received a preliminary report. Let me say that again. Earlier today, I received a preliminary report of Omicron detection in a Mobile County resident. The sequencing was performed by a local laboratory, and we are working with that laboratory now to confirm this report of Omicron in a Mobile County resident, and we'll let you know more about that next week or through our social media when that is confirmed. It is highly likely that Omicron is here. It's just that, prior to now, the volume of PCR tests coming in for COVID-19 positive patients was quite low, and so we didn't have a lot of specimens to perform sequencing on. But as more and more people are getting COVID, then we're able to sequence specimens from more and more patients. So not a surprise that we have probably detected Omicron in Mobile County. Can a person catch COVID and influenza at the same time? Yes, that is entirely possible. All right, next group. This is, I think those first questions were from WPMI, and then here are some more questions from WPMI. Let's see. Please address the push to mandate vaccines for people flying domestically. So there was a report, I think, in U.S. News. I can't remember. Yes, U.S. News. That there are some Democratic congressional leaders that are pushing for federal mandates from FDA and CDC and Health and Human Services to require vaccination or testing for domestic travel. And, federal mandates for domestic and international travel, these are not new concepts. I mean, we saw changes following 9/11 to protect Americans, like restricting liquids and sharp objects carried on board planes or even in the airport. Remember, we all had to start eating with plastic spoons because plastic forks were thought to be, could be used as a weapon. So those things were put into effect after 9/11 to protect us. Also, we, had to begin doing, removing belts and laptops and shoes, get those things scanned, started having to do, subject to full body x-ray. And again, all of these mandates were required after 9/11 to protect Americans and to protect people visiting America. So federal mandates for the protection of Americans and, during travel is not new. Also there are already federal mandates related to COVID for the cruise industry. And despite those mandates, people are, not surprisingly, it's not a shock, cruises are still reporting, COVID positive people on cruise ships, despite the federal controls that have been placed upon the cruising industry. So while I support, prevention efforts for everyone, I just am not sure how well federal mandates will work. Of course, they could have the potential to be highly politicized. It's potential to further polarize our democracy. So I'm skeptical about how effective they might be, but like I said, it's not unprecedented, and these things have helped in the past to protect us from threats, both natural and man-made. All right, let's see. Yeah, okay, let me go back to a question submitted by Lanya asking, is there optimism among public health experts that with vaccination boosters or other precautions that Omicron doesn't appear as deadly as other variants? So there is information that is growing, data that a growing body of evidence that Omicron, while more highly infectious than Delta or any other COVID variant that we've seen, that it is likely less severe, that it causes less severe illness. Now, this was the fact in South Africa for sure, but it was among younger populations We've been kind of waiting to see what it looks like when it hits the U.S. population. For example, we don't know what it looks like when it gets into K through 12 schools, or what it might look like when Omicron burns through a nursing home or a detention center. So while there are, lots of places now that have predominantly Omicron circulating, we're learning more and more. It does look like Omicron is going to cause less severe disease than Delta or Alpha or the parent strain caused. But again, we're still collecting information. There was also a report that Omicron, you don't have loss of taste or smell with Omicron like you do with the other COVID. I think, it took us a year sometime or 9 months or more to determine like all of this myriad of symptoms that could be related to Delta or Alpha. So it's probably going to take us, quite some time. So I think that the data just sort of, continue to pay attention. I think things are going to continuously change until we learn a lot more about how Omicron is going to behave in the U.S. I am optimistic that that Omicron may be less severe. However, I mean, if you think about this, if it turns out that it's 10 times, if it causes 10 times the number of cases, the fact that it might be 10 times less deadly could put us right at the same number of deaths we saw in August and September. So even though it may be less severe disease, if we have hundreds of thousands of people getting infected with Omicron, I still expect we could see a high number of hospitalizations and maybe even a large number of deaths. Certainly, any death that could be prevented through vaccination is a death too many. Let's see. Okay. Someone asking if I have a good sense of how dominant Omicron is in Mobile County. I probably will know next week. If Omicron behaves here like it has everywhere else, we will see probably a rapid increase, a rapid displacement of Delta when Omicron begins being transmitted person to person in Mobile County. These first preliminary reports that I probably will receive later today will be working over the weekend to determine if these people had travel outside of Mobile or outside of Alabama, or if they were around anyone who had recent travel domestically or internationally. And very quickly, as it's the same thing happened with Delta, we did some really close investigating in the beginning, and it only took about 10 days for us to realize that it's going person to person, and it's really sort of, the horse is out of the barn at that point, and we just had to do our best to keep up with calling people to tell them that they were infected and needed to stay home. Once it takes hold in the community, we're not going to be able to stop it. There are some estimates that half of all Americans will probably get infected with Omicron. If you are vaccinated, you have a better chance at preventing infection. And if you do get infected, you will, have less severe illness, but it's going to be very hard to stop transmission. So what we will do is do things like if we talk to someone who has one person in the household that has Omicron, basically everyone in the household will have to stay at home. Because we just, it's too highly transmissible to think that you can keep from transmitting it to someone else who lives with you, regardless of their vaccination status. Remember, a week ago Tuesday, so CDC updates their estimates on Omicron, how it's, what percentage of all infections are Omicron. A week ago Tuesday, so just 10 days ago, CDC estimated that Omicron was 3% of all infections in the United States. This past Tuesday, so just 7 days later, that estimate went up to 73% in 7 days. So it went from 3% to 73% in 1 week. So it's very likely that by next week, the estimate will show that Omicron is upwards of, 85, 90% of all infections in the United States. And I expect that Mobile County will follow very quickly with the same pattern. Someone asking if I think we're at the beginning of another wave. Definitely. Definitely. You know, it's sort of striking and troubling. I was sort of hoping that at least maybe we could get through the holidays, but I don't think we're going to escape it. And then a question about, is it possible that we're going to escape Omicron because we had so many people infected with Delta in August and September? Is that why it's been delayed getting here? Maybe, but when you get disease-induced immunity, you're protected for a good 90 days, and that ends for everybody that got Delta in August and September. Your 90-day window of protection ends with with December 31st, 2021. That's, everybody will be past their 90 days by the end of the year. So we're going to be a naive population, right? We're an Omicron naive population starting January. So that it's come here at this time, I don't think it's coincidence. I think it's biology. And again, get vaccinated so that you don't have to keep going through this and catching whatever variant is coming our way. But yes, this is definitely the beginning of another wave, and it's likely to get very bad as far as the number of infections. All right, if people travel together for the holidays, should they get tested just in case? Yes. You should get tested, maybe even before traveling across town to go to your mother's house for holiday dinner, or tested before going to midnight mass or your church service. So yes, get tested. Let's see, is our area prepared for the spike? CDC predicts we'll see cases in January. I don't think we're ready. We still have too many people in Mobile County that need to get vaccinated. And, the percent of vaccine coverage actually went down when vaccines were made available to 5 to 11-year-olds. So the denominator sort of opened up a little bit. So we're still around, low 50% that are fully vaccinated, but we're not prepared for another variant. We don't have enough people vaccinated. And we still have a lot of people who need to get a booster. So even if you had COVID, please get vaccinated. You might see the stories out there that there are data and there's evidence to show that if you have a disease-induced immune response and then you get vaccinated, you may have like this super immunity to COVID. So you could have that on your side. But, I think that in August and September, we had a record numbers of hospitalizations and deaths, and the overwhelming majority of those were in unvaccinated people. We could have prevented so many deaths if people had gotten vaccinated, and it's not improved much since then. So, following August and September, some of us survived. We had many people who died needlessly. Our healthcare system survived, but they were, beaten and bruised. But we've shown that we will be able to cope, and we'll deal with whatever is thrown at us. But I don't think that we are ready for what is about to happen with Omicron based on what I'm seeing data out of other places and estimates by people who are a lot smarter than I am. What is MCHD's biggest concern? I'm concerned about COVID fatigue. Everyone wants COVID to go away. They want to act like it's not here any longer. The apathy for hearing messages and being asked to wear your mask and to distance, people are we thought they were tired of it last year, 12 months later, and I'm telling you, there is COVID fatigue out there, y'all, not just in the healthcare industry and in the public health and, other, community-based organizations and non-governmental organizations that have been trying to help, churches that have been trying to help, but the public is just fatigued. And so I worry about that because we still, have a lot of work to do to keep our community strong. We have too many people not getting vaccinated and not getting tested when we have free testing available right now, or not taking the threat to vulnerable people seriously. I was speaking with a constituent whose grandchildren aren't vaccinated, and she's struggling with knowing whether to have them come over, during the holidays. And I said, well, you could buy some at-home kits, test kits, and test them before they come into your home. And the grandchild just happened to be sitting there and heard me say that and said, well, that's one way to keep her from seeing her grandkids at Christmas. And I said, yeah, but it's the best way to keep her alive. So just the apathy and this sort of lack of understanding, or maybe care, that some people have about how they will survive. Certainly they will, but they are a risk to others who are vulnerable. All right, and then the last question was about a tweet. I don't even tweet, but somebody in New York talking about test positivity doubling every 3 days. What are we doing in Mobile County to prevent that from happening? I'm not sure we can prevent it from happening, because what we need is for people to remember it's not over. COVID is here. It is a real and present danger. The new variant is much more highly transmissible. We still have very low vaccine coverage rates. We need many more people, kids aged 5 to 17, and young adults 18 to 25, and even from 25 to 50. We need many more people in those age groups to get vaccinated. And so we continue to talk about it. We continue to go all over the county providing vaccine events. We keep our clinic open 6 days a week to offer free walk-in testing and free vaccination with any vaccine that someone wants. So these are the things that we're doing to try to keep things from doubling every 3 days in Mobile County, but we can't do it alone. We really need the support and the participation from the community. And remember, over the holidays with gatherings, be smart, protect the people who are most vulnerable, use testing as a knowledge tool, as a powerful tool to reduce transmission in your gatherings. Wear a mask if you're going to any indoor setting or a large outdoor gathering where you're going to be in close proximity with people. Be careful, be smart, layer on those prevention measures, and enjoy your holidays. We'll talk to you next week.